had traditional heart surgery, then you know the recovery can be tough. But thanks to new techniques at Memorial Hermann, that recovery time is much faster and the procedures are much less traumatic to the body. From Memorial Hermann, please welcome cardiologist Dr. Sanjay Kumar Patel and cardiovascular surgeon Dr. Miguel Gomez. Good morning. Good morning. I watched my father go through quadruple bypass surgery, and it seemed like to me the healing process, the recovery process, was more painful than going through the heart attack. Explain what the traditional methods usually are.
Well, traditionally, as we all aware that people need quadruple bypass or any sort of intervention, including the stent or balloon for the clogged artery. And nowadays we have very innovative ways and minimally invasive ways to deal with both. First, to diagnose the clogged artery, and the way we do nowadays is through the wrist, unlike from the groin. And as you see, these catheters, they are about 2 millimeter in diameter, and they go through the wrist just like here.
Wow.
And through those, I put this long catheter which would go through the wrist up to the heart, get into the artery, take the pictures, and diagnose the clogged arteries. And treatment would depend what it is. If it's one or two, we could fix it with the stent through the same thing through the wrist nowadays.
That's amazing. Now, going through the groin, what made going through the groin so much tougher than going through the wrist?
Well, going through the groin has been traditional. The biggest advantage of going through the wrist as opposed to the groin is the quick recovery. All patients, they almost immediately can sit up after the procedure, unlike they have to lay down for 2 to 6 hours after the groin. As well as the cost saving is tremendous. Means the complications are very low, almost 0%.
Wow.
Through the wrist bleeding complication as opposed to the groin. So dealing with the complications, including length of stay, blood transfusion, using imaging diagnosis, is just amazing. And all my patients love it, hospital likes it, and that's the reason I love it.
Yeah, if you can have almost zero complications and get up and go much faster, then there's no reason not to love that. All right, and Dr. Gomez, robotic technology has also kind of given you a great assistant in the operating room.
Yes, without a doubt, in the last few years with the robotic technology, it's allowed us to perform complex surgeries through tiny incisions. As most people know, when they do bypass surgery on a patient, they usually have to divide the breastbone and spread the chest.
Crack the chest, basically crack it open.
Right.
Yeah.
And with the robot, it's allowed us to tackle this problem by making small incisions between the ribs and to accomplish the bypasses. And of course, with that less trauma to the patient and the less invasiveness of the procedure, patients recover quicker, and they have less complications, less blood transfusions, they get off the breathing machines quicker, their hospital stay is shorter, and they're back to normal activities within a couple of weeks.
Yeah, and I would imagine certainly reduces the chances of infections as well. Exactly,
it does. As you make the bigger the incision, the more likely that you can have an infection occur and get bacteria into your wounds. So the robot allowing you to make smaller incisions, your infection rate is going to go down.
Yeah, it's amazing how fast technology has moved to address many of these issues. But at the same time, technology says we're going to address all these issues. We haven't been so great about taking care of our own health in many cases. So just before we wrap things up, to avoid or at least reduce your chances of dealing with heart disease, let's go over some of those things again that people need to do to take their own responsibility.
First and foremost is your lifestyle. Everyone has to start paying attention to that. And number one is, the fast food industries. We have to watch what we're eating. We have to exercise. It's just, all routine things. Everyone knows they need to do it, but we always need someone to tell us. So you can come to us and we will let you know. We will direct you how to do it and how to get the best results.
So what you're eating, exercise, smoking?
Yes, no smoking. More importantly, I think a lot of people feel like when they don't have any symptoms that everything's okay. And I think it's real important that everybody get an annual physical from a doctor and get that baseline evaluation to make sure that everything's okay. And I think that's a very important feature of keeping good health.
Because that's one of those things that builds and builds and builds until you have the big one.
Right.
My dad was 81 when he had a quadruple bypass. He's 91 today and doing great. So thank you all for the work that you do.
Thank you, Deborah.
Thank you, Deborah.
For more information about these procedures and so much more about Memorial Hermann, you can log on to memorialhermann.org. Speaking of the heart, you can see one and many other real organs at Body Worlds 2. It's an amazing opportunity to see what's inside of us. 4 members of our audience will get a family 4-pack back. The exhibit ends this Sunday, and beginning tomorrow at 9 a.m., the exhibit is open 24 hours. When we come back, all week we've had a cultural exchange between people from Houston's largest communities. See what happens when Chow Nguyen goes from a Vietnamese Catholic church to a Black Baptist church. It was a little different. We'll be right back.